In we come, Frank. I'll just get you to sit over here on the plinth if that's okay. Good-o. And just have a seat. Lovely. Excellent.
Perfect.
Frank, I forgot to ask you some questions before, so is it okay if I ask them now?
Certainly.
Okay. So you said that when you're in physio at the moment you get short of breath only when you have severe exertion. What sort of activities provoke this, do you think? Could you describe the severe exertion?
What, in the physio or just overall?
Well, what sort of activities make you short of breath?
Playing bowls.
Playing bowls,
because you deliver the bowl and you've got to walk up and back. And
okay.
depending on the weather conditions.
Okay.
A pretty warm, humid day plays havoc.
Okay. So how about in the physio gym, what sort of activities make you short of breath?
Not quite, but pushes it a bit. Primarily is riding the bike, and the other thing is step.
Okay.
The one that goes...
Ah, the stepper, yes.
Yeah,
okay.
It is vicious.
Okay. So Frank, if 0 was feeling no breathlessness at all, and 10 was the worst possible breathlessness that you could imagine, how would you rate your breathlessness in the gym?
About 4.
About a 4, okay. Yeah. And playing bowls?
Depending on the day, on a good clear day,
yep.
Negligible, because in between you're putting bowls you can sit down.
Yeah, but when it gets bad?
6, 7.
Okay, all right. Now also when you're walking, when you're at home, roughly sort of how much distance are you able to walk before you need a rest?
Round about, we've measured all this.
Oh, okay.
Before all this hospital started.
Yep.
We used to walk about 1.7 k's.
Okay, before you needed
round our block and
yep.
down round, yeah.
Before you needed a rest.
Before we both needed it.
Okay. And since you've been here, walking around the ward, do you feel short of breath or?
Not really, no.
Okay,
no, it's pretty good.
Okay. I also forgot to ask you about your medications. So when you're at home, do you have medications that you need to take frequently?
Yes.
Yep. And do you know what they are?
Yes. I take Diamicron because I'm diabetic, type 2.
Okay.
Also Diabex. And I take Lasix. That's to keep the fluid around the heart, etc., under control. And I take Micardis for high blood pressure.
Do you take any medication for your lungs, for your breathing?
I've got puffers.
Okay.
Yeah, 2 of those.
And do you take those frequently?
Oh yeah, morning and night.
Okay, good. So you generally keep up with all that sort of stuff. Good, that's good. One last question. At home, have you got any stairs?
No.
No? So not a step anywhere?
Well, yeah, step into the house.
Yep. And do you manage that quite well?
Oh, easy.
Oh, good.
Like leading in, we have a veranda on the front of the house, the side.
All right.
There's a little step at the end which we use because that's right to the garage. In front, we have 3 steps.
Okay.
Which we don't use.
You don't use them?
No.
Okay. So you can get into the house without using them?
Well, this is all brought about because of hip replacements.
Yeah, all right. Good-o. Okay, Frank, do you mind if I have a bit of a listen and a look at some things?
Certainly.
Now? So I'm going to have a look at how your oxygen's going. Thank you. So just rest your hand on your leg there. Perfect. You're doing well. So Frank, if you don't mind, I'm going to have a bit of a listen to your chest. Is that okay?
Yep.
I'll just shut the curtains. A little bit. So do you mind if you take your shirt off?
It'll upset me hair.
That'll be all right. Now if you want just to hold on to this at the front, make you a bit more comfortable. So I'm just going to have a bit of a listen, and I want you to take some big deep breaths through your mouth, in and out through your mouth. If you get dizzy, just let me know, okay?
Okay.
In and out. Big one in. Good. Good. And out. Do you mind if I have a listen to the front? Getting dizzy, or are you feeling all right?
Okay.
You all right?
Yep.
Good-o. Big deep breath in. And out. Good. And out. Good. And again, in. And out. And in. Good. Okay, one more. Good. Thanks, Frank. If you need a hand putting your top back on,
Yeah, I see that.
you'll be right.
Yep.
Yeah, looks fine. Good. Frank, could you just do a bit of a cough for me?
Certainly.
Okay. Yep. Now, did that hurt anywhere, or did that feel all right? Okay. Now, do you mind if I put my hands on your chest there? I'm just going to get off this chair. There we go. So can you take a big deep breath in for me? Good. And out. Good. And again. Good. And out. Okay. Can you have another cough for me? Is anything coming up there, or is it just...
No.
Okay. So usually is it a bit thicker than that, or is that normal?
Oh, beforehand, very, very.
Okay.
Now, normal.
Normal. Okay. Good. So Frank, I'd also like to have a look at how you're walking and how your balance and strength is as well. Is that okay?
Yep.
So we might go out to the gym and have a look at that. Okay.
Sure.
So how are you feeling after that walk?
Very good, thank you.
That's good.
Very
You did
good.
well. Okay, so your oxygen's gone down just a tiny bit, but it's still okay. Your heart rate's gone up a little bit, but that's to be expected.
Good.
So we're on, your oxygen's about 95 and your heart rate's
Excellent.
about 77.
Good, very good.
Good-o.